My name is Heather Vandiver, and this is my health assessment head-to-toe video for spring of 2021. I'm going to first show you the room. This is my patient. My dad, who will be pressing the stop button for me. Okay. All right, first I'm going to enter the patient's room and introduce myself. I will then wash my hands. I will be doing a head-to-toe assessment on you today. If anything I do hurt you, please let me know. I will first be starting with the head, noting that it is symmetric. I will be assessing the skin. Every time that I assess the skin, I'm going to be assessing for color, temperature, moisture, texture, edema, turgor, scars, lesions, bruises, and nevi. I'm going to start with the scalp, noting that the scalp is symmetrical. No indentations or infestations. And then the hair color is light brown and some male pattern baldness. Next, I am going to assess cranial nerve 5. Have the patient clench their jaw for me. I will assess TMJ here as well, noting no crepitus or tenderness. Next, I will assess cranial nerve 7. Lift your eyebrows for me. Smile real big and show me your teeth. Frown. Pucker your lips. Puff your cheeks out. Cranial nerve 7 is intact. Next, I will assess the lymph nodes. I'm going to palpate first over the temporal arteries, making sure no tenderness. I'm going to start with the preauricular lymph nodes, postauricular, occipital, tonsillar, submental, submandibular, anterior cervical, posterior cervical. If you will shrug your shoulders for, supraclavicular. Perfect. Next, I'm going to go to the eyes. I'm going to assess the lashes and brows, make sure they are free of infestations. Assess the sclera and conjunctiva for any redness or drainage and discharge. I'm going to assess cranial nerve 2 by having the patient read the lowest line on the eye chart that they can.
LTFBH.
20/20 vision. Next, I'm going to assess cranial nerves 3, 4, and 6. First, checking the patient's pupillary response to light. Pupils are round, equal, and reactive to light. Noting accommodation and convergence. If you will look at the door and look back at me, we're going to assess the extraocular movements of the eyes. Follow my finger with your eyes only. Perfect. Okay, next we're going to assess the nose. Noting that the nose is symmetrical and midline, we're going to look at nasal patency. If you will sniff, sniff. We'll assess inside of the nose, nasals are patent. Then going to palpate over the frontal and maxillary sinuses for any tenderness. Next, going to inspect the ears. I'm first going to inspect that there is no deformities, the skin is intact, there is no swelling or drainage noted, no tenderness over the pinnae or the tragus of the ear. I'm going to look in the ear canal bilaterally, noting that the canal is pink in color. Tympanic membrane is gray and pearly with no fluid, redness, or swelling noted. The right ear canal is also pink in color. Tympanic membrane is gray and pearly in color with no fluid, redness, or swelling noted. Next, I'm going to assess the mouth. I'm going to assess the lips, the tongue, the teeth, the gums. Stick your tongue out for me. The tonsils are not present. I will also note that the cranial nerves 9 and 10 are intact by the uvula and soft palate rising. And also note that the tongue, if you stick your tongue out for me, is free from fasciculations for cranial nerve 12. Next, I'm also going to assess cranial nerve 8 for your hearing. I want you to tell me when you can no longer hear this.
Okay.
When you can no longer feel it?
No.
Okay. Bilateral bilaterally, air conduction is greater than bone conduction. Next, we're going to assess the Weber test. Would you tell me if you can hear this bilaterally?
Yes.
We're going to assess the whisper test. I'm going to get behind the patient. I want you to repeat what I say. Okay. Next, we're going to assess the neck. I'm going to assess the skin of the neck, noting no deformity. Trachea is midline. I'm going to palpate the thyroid. I'm also going to palpate for bilateral carotid pulses. I will listen over the carotid artery for any bruits. I'm next going to assess cranial nerve 11, having the patient shrug their shoulders against resistance. Okay, and then I'm going to test range of motion of your neck. I want you to flex, extend, hyperextend, laterally flex, and rotate for me. Perfect. Okay, next we're going to go to posterior chest. If you will, turn around for me. I'm first going to note the skin of the posterior chest, symmetrical. I'm going to assess tactile fremitus. Say 99 for me.
99.
Okay, bilateral tactile fremitus. I am then going to percuss over each lung field. I will then auscultate over each lung field. Deep breath. Noting that breath sounds are equal and clear bilaterally. Next, I'm going to check for egophony. I'm going to have the patient say E every time that I put my stethoscope on you.
E. 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 E.
Next, I'm going to check for bronchophony. Have the patient say 99 every time I put my stethoscope on you.
99. 99. 99. 99. 99. 99. 99. 99.
Next, I'm going to test for whisper pulchrum. I'm going to have you whisper 99 every time I put my stethoscope on you. Perfect. Okay. Now I'm going to assess the anterior chest. Turn this way for me. I'm going to assess the skin, noting that the patient is in no respiratory distress, no retractions, no nasal flaring noted. I'm going to auscultate over the lung fields. Take a deep breath each time I put my stethoscope on you. Next, I am going to auscultate over the 5 areas of the heart with the bell and the diaphragm. First, I'm going to start with the aortic, pulmonic, Erb's point, tricuspid, and mitral. Next, I'm going to note the point of maximal impulse, and I'm going to listen for an apical pulse for a full minute, noting rate is 75 and rhythm is regular. Next, I'm going to have the patient lie down. I'm going to note any heaves or lifts. And I'm going to listen over these 5 areas again, 5 areas of the heart. I would then lift the patient's head of the bed 30 to 45 degrees to assess for jugular vein distension. After that, I'm going to go to the abdomen. I'm going to assess the skin of the abdomen and symmetry of the abdomen. I'm then going to assess over the arteries for any bruits, starting with the aorta, renal arteries, iliac, femoral. I'm next going to listen for bowel sounds in each quadrant. Next, going to percuss for any flatness or dullness in each quadrant. I will then palpate for any masses or tenderness. Then going to palpate the liver. And palpate the spleen. going to have you go ahead and sit up for me. I'm going to assess CVD in the back and let me know if there's any tenderness here.
No.
Next, we're going to assess the upper extremities. I'm first going to note that you can feel me equally on both sides. Can you feel me equally on both sides of your legs?
Mhm.
Perfect. We're going to start by inspecting the skin of each joint for redness, swelling, or tenderness. We're going to assess the range of motion of the fingers first. I'm going to check capillary refill. Capillary refill is less than 3 seconds. We're going to have you flex, extend, adduct, and abduct your fingers. Have you squeeze my hands as hard as you can. Noting hand grips are 5 out of 5 for strength. I'm going to assess the radial pulses. Radial pulses are 2+. I'm then going to assess vibratory sensation.
Yes.
I'm
Yes.
going to also assess it over the mouse.
Yes.
Next, I'm going to assess the joints of the wrist, noting no swelling, redness, or tenderness. Range of motion of the joints, flexion, extension, rotation. And then going to assess the elbows, noting range of motion of the elbows, no redness, swelling, or tenderness over the elbow. I'm going to assess bicep and tricep strength. Terms like this for me. Don't let me pull you down. 5 out of 5 bicep strength. Don't let me pull back. 5 out of 5 tricep strength. I'm then going to assess the shoulders, noting no pain, swelling, or tenderness in the shoulder joints. I'm then going to have the patient extend, hyperextend, and internally rotate, and then we're going to circumduct. Perfect. Go ahead and sit down. I'm going to check the strength of the shoulder girdles. Hold your arms in like this. Don't let me push out. We're in. 5 out of 5 strength for the shoulder girdle. Next, we're going to assess the graphesthesia. So I'm going to put an object in your hand and I want you to tell me what it is, okay?
It's a pen.
Okay. Next, I'm going to draw something on your hand for graphesthesia. I want you to tell me what letter I'm trying. Close your eyes.
It's a P.
Next, we're going to assess for cerebellar coordination. You should flip your hands on your lap for me. Back and forth. Perfect. Touch each finger to your thumb. Good. Should touch my finger and touch your nose. Perfect. Okay, next I'm going to assess the deep tendon reflexes, starting with the brachioradialis. Okay. Bicep. Tricep, patellar, Achilles, and I'm going to assess the Babinski reflex. Okay. Perfect. Next, I'm going to go to the lower extremities. I'm going to start by assessing the capillary refill of the toes, noting that it is less than 3 seconds. And you can feel me equally on both sides. Okay. We're going to assess range of motion of the toes, flexing, extending, perfect. And then going to assess the ankles, noting no swelling or tenderness of the toes or the ankle joints. If you will rotate your ankles for me. Perfect, flex and extend. I want you to push against my hand like a pedal. Strength is 5 out of 5. I'm going to assess the dorsalis pedis and posterior tibial pulses, noting that they are present in 2+. Next, I'm going to assess the knee joint, noting they are free from redness or swelling and tenderness. I'm going to have you extend and flex. Perfect. Extend and flex. Next, I'm going to assess the hip joints, noting that they are free from redness, swelling, or tenderness. I want you to flex. Perfect. Flex. Adduct, abduct, perfect. Don't let me push you apart. We push together. 5 out of 5 strength for the hips. So I'm going to have the patient stand up. Going to assess hips standing up, flexion, extension and hyperextension, flexion, extension and hyperextension. Next, I'm going to assess the patient's spine and spinal flexion. If you will, bend over and touch your toes. Noting that the curvature of the spine is straight and symmetrical. No scoliosis noted. Extend, stand up straight. Hyperextension, leaning back a little bit. Lateral flexion, each side. Perfect. Rotation. Perfect. Once you turn and look at me, we're going to assess for the Romberg sign here. I want you to keep your feet together and eyes closed. We would assess this for 1 minute. Then we're going to assess the patient's gait. Open your eyes for me. I want you to walk to the door and walk back, noting that the gait is regular and tandem. Come back towards me. I want you to hop on one foot for me. Perfect. Hop on the other. Perfect. You can have a seat. That concludes my head to toe assessment. Thank you.